Well, hello again, everyone. Welcome back to Advanced Lifestyle Medicine. So we're launching into Module 3 or Week 3. And so this is the point where we start applying some of these lifestyle medicine concepts to specific conditions, chronic diseases that are listed in the book. And of course, this is not a exhaustive list of conditions, um, but it's a place to get us started, and it's some of the most significant conditions that you'll see or do see in practice. And so the point of this part um, of the course is to have you start putting the connections together in the foundational information that you just studied about um, the fundamental lifestyle medicine components, and then how those apply to various conditions, chronic conditions. For example, you'll talk about, you'll study obesity and high blood pressure and heart disease and diabetes. So what are first of all, where we start with is what are the guidelines of those conditions, the national guidelines say about implementing lifestyle medicine activities to help mitigate and even prevent those conditions. But at this point, we're a little bit beyond the primary prevention mode. Technically, we're still in the primary prevention mode, but preventing, not necessarily preventing the risk factor for, say, heart disease, but really preventing heart disease by mitigating that risk factor, the blood pressure, or the cholesterol, or the diabetes. So anyway, so how do you talk to somebody who has high blood pressure about exercise? What are the kind of exercise they could do? How much exercise is enough? What is the exercise going to do regarding blood pressure? What's it going to do to lower the risk for heart disease? So that's the kind of information we start putting together, and this is important because as we progress on in the program, we'll look at designing a comprehensive lifestyle medicine program for all kinds of people with varying conditions. And so we'll start with something simple, and then progress our way up to complex individuals who have several chronic conditions at one time, and how do you put together a comprehensive program with them to meet the goals that they want to achieve. One of the things that I wanted to steer you to in the book is on page 175, 6, and 7. And this is direct application of what the foundational components of lifestyle medicine do for specific chronic diseases. Okay, so specifically in 175, we're talking about high blood pressure. And these images I'll send to you in a color format just via email and blue line, so you have them. But just so you know, these umbrellas is what we refer to them, were created specifically for our program to be implemented in a way that to make it easier to talk to people who have these chronic diseases about what lifestyle activities can do for them to help manage their blood pressure, for instance. So just by way of introduction for these images, and they're all color. This one happens to be primary color. The cholesterol, there's 3 of them. High blood pressure, the cholesterol one is in a fall kind of colorish, and then the diabetes one is in kind of a pastel spring sort of color. So what we have done with those is we have these in poster size in the rooms that we meet with our folks for our employee wellness program, the cardiovascular and diabetes risk reduction program. And we refer to them a great deal because this is kind of how they're set up. So we used an umbrella as a symbol of protection. And for instance, in this one for high blood pressure, the title of these is Lifestyle is Medicine. And we purposefully use that because we wanted folks to start making the connection that in order to treat high blood pressure, you don't just have to take medicine. for it. There are other ways to do it. So we put that title, Lifestyle is Medicine, to kind of get across that message right from the start. And so there's a bit of narrative that's in the cloud of each of these specific to the condition. So this one says medication can help lower your blood pressure, but so can lifestyle. This umbrella shows some of the healthy lifestyle choices you can make. Protect yourself from heart disease, stroke, kidney disease, and other health problems by taking your blood pressure medication and by living a healthy lifestyle. How much protection are you getting from your umbrella? So we used umbrella as a symbolism of protection, and it could be protecting from the rain or from, in this case, from the sun or sunburn, for instance. And so each section of the umbrella represents a different lifestyle activity. Blood pressure is the easiest one to talk about because there are so many lifestyle activities that have a positive effect on blood pressure. And so what it does is it compares how much blood pressure lowering you can get from doing the various activities. One of the sections of the umbrella is also medications, because it's still important to talk to them about, if they need medication, they need to take their medication. And that part's an important piece, so it needs to be in the umbrella. But also, it's a way for them to compare, and this is the way we often do it, compare, should I increase a dose of the medication? So say the scenario is, just to give you a typical scenario, you have someone who is doing well, or maybe not doing well, and you measure blood pressure, and it looks like it's far enough out of range where you need to make a decision. Should we increase blood pressure medication? Should we add a medication? Or should we do something different, like intensify lifestyle therapy? This helps the patient to decide, or the client, whatever you want to call them, which is the best place, which is the best action to take. So in this case, and this is all evidence-based literature. If you want the references, I can certainly send those to you also. But taking a dose of a medication when someone first starts on the medication, and then subsequently increasing the dose when it's needed, there is a systolic blood pressure lowering of between 7 and 26 millimeters of mercury. So just to familiarize with this, systolic pressure is the top number, so 120 over 80. For instance, as an example, the 120 is systolic blood pressure. It's higher because it's the pressure measured on the walls of the artery as blood flow is going through it. Diastolic pressure, the lower number, the bottom number is lower because it's the pressure on the walls of the artery as blood is not pushing through, but it's just it's in the vessel, but it's not pushing through. So so the systolic number is the one that is higher in the two, and for most of you, you know this information already, but for those of you who don't, the systolic pressure, both are important to measure. Systolic pressure has, depending on the age, but it's got a lot of correlation to heart disease. And so for our umbrella, we chose to just use systolic pressures to report out of this to make it simple. So what you're looking at is when it says a number in here, for instance, 7 to 26, it's 7 to 26 millimeters of mercury, because that's how blood pressure is measured. And that's talking about the systolic pressure. So a dose of the medication lowers it 7 to 26 millimeters of mercury. By comparison, healthy eating, 8 to 14. Regular exercise, 4 to 9. If someone would stop smoking, it's 3.5. Limiting salt intake is 2 to 8. Limiting alcohol is 2 to 4. Controlling stress is 5. Losing weight is between 5 and 20. But here's the thing with these. If you combine these, they're additive. So if you do both healthy eating and regular exercise, then your range becomes 12 to 23 millimeters of mercury decrease. And so now we're talking about something that is similar to taking a dose of a medication. So what we will often do this is why we have these up in the rooms that we're talking with our folks, is that we can say, okay, here's the situation. We need to probably decrease, I'm just going to use a scenario, systolic blood pressure, say another 7 millimeters of mercury. So this is what we're doing well already. Maybe some exercise, but not necessarily eating. So if we start to do these certain things for healthy eating, and we can talk about that further, but it's also in the book, in the chapter, then that will lower it probably within the range that needs to be without. So you can choose either healthy eating, or you can choose going up on the medication. And if you choose both healthy eating and to, say, limit salt intake, then you combine those two sections of the umbrella together. There's an additive effect, and this is the best part about this, is there's an additive effect with these lifestyle behaviors. So the point in the umbrella is to say, how much protection are you getting? In this case, for someone who has high blood pressure, it's stayed on their protection from heart disease, stroke, kidney disease, and other things, of course. But how much protection are you getting from your umbrella? Your umbrella is specific to you. You take your medication, you just have one section. If you want to get full protection with your umbrella, let's add in a couple more sections. And so it's a good visualization, and it makes it a bit more concrete than to just say to someone who has high blood pressure, well, your blood pressure's up, you really should start exercising more, because it'll help. This helps them to make that decision, as to say, okay, I get it. This is what I can expect from doing this activity. Same thing goes for the cholesterol and for the diabetes. Cholesterol, again, it lists medication there, and the statin drugs that we use to treat cholesterol, you can get a very large decrease in LDL cholesterol. And that's what we're talking about on this is LDL cholesterol, as it says in the diagram here. And it is a range. LDL cholesterol can decrease anywhere from 5 to 55%. And of course, there's all kinds of medications for this, so that's why the range is so big. But then you can see on here that there are several nutrition-specific, like adding plant sterols and stanols, decreasing dietary cholesterol, adding soluble fiber, losing weight, or decreasing saturated fat. Those are what's included in the umbrella for the cholesterol. And as far as diabetes goes, the measurement here is estimated average glucose. If you want to have a further conversation about it, I can tell you why we decided on doing it that way. But medications, of course, is still on here too, so we have something to compare it to. Limiting carbohydrate intake is one. Regular resistance exercise, so like weightlifting, resistance training, can be in the gym, can be doing it various ways, and there's some really great research on resistance training and how muscle contraction is very effective. A loaded muscle contraction is very effective for managing blood glucose. In fact, you can even simulate the way some of the medications work, metformin being one of the most commonly and popularly used medications, by doing resistance training exercises. So this can be at the gym with weights, it could be at home with bands, it could be at home with soup cans or laundry detergent bottles. That's the great thing about doing resistance training, is your muscles don't know what it's pushing against. So you can use whatever works and is convenient. Another one on here is then aerobic exercise. So there's two different exercise ones, the resistance training and then the aerobic exercise. Losing weight is on here as well. So I encourage you to give a look at these. Of course, they're in black and white in your book, and like I said, I'll send those to you in the color version so you can see what they look like. If you're interested in where the information comes from to get those numbers, I can send that to you also. So just let me know. So in any case, things are going great so far. First couple weeks into the program, into this course, and we're just, again, this is Friday of week 2, so discussion sections were just submitted last night And so I've skimmed through them and been following through, but haven't read them in a lot of detail yet. But it looks like the conversation is just going great. I'm really happy with the depth. And again, what I encourage you to do, it says in there to ask questions. And I encourage you to think about this in a way that you gain greater depth of the material by asking the questions. So, for instance, something like this: why does doing resistance exercises decrease blood glucose? Okay, so those kinds of questions to try to get some greater depth and stimulate some conversation, probably pulling in other resources or reference. Try to do that as opposed to saying, what is your opinion about, or how would you do something that maybe, well, that may be appropriate, but something that just asks an opinion of a classmate. Let's try to focus our questions to each other in a way that pulls in some evidence. It gains greater depth in the material that we're talking about. So keep up the good work. I'm really enjoying reading your material so far. I'm really looking forward to the survey project. And so what we will do with that is, as soon as I get to that information, which will be the first part of the week, I'll summarize that and then send it back out to you, so you see what everyone collected in aggregate of data. And that way then we can compare what you all collected for data to what we talked about in the first week. And that is to say, what are the factors that determine people's health? You asked people that. And how does what you asked them relate to what the data is showing us on a national level, or even at a population size level? So that should be a good conversation. So if you have any questions, just let me know. Keep up the good work, and hope things are going well. Thanks.